Alfred Joachim Olul has been living with high blood pressure since 2019 following a border accident. We found him at the Uganda Heart Institute seeking care for hypertension.
When I had the accident, I was rushed to the hospital. That's when my pressure was tested and it was too high. So from then on, I was put on drugs for quite some time.
Olul cannot find a clear explanation on what raised his pressure, but he says the accident was minor.
I think the body was in some kind of shock after the accident. So I didn't get any serious damage, internal damage or broken limbs, but the pressure just shot up.
He was then advised to use medication to regulate his blood pressure.
And go back for another test after 2 weeks. After 2 weeks, the pressure was still high, so the doctors told me to continue the drugs.
Alfred Olul is just one of the many Ugandans that have hypertension. The prevalence of the condition is 27%. Hypertension is among the leading risk factors for human mortality worldwide and is both more common and less well controlled in many low-income countries, especially in sub-Saharan Africa, than in more affluent ones. It is estimated adult hypertension prevalence is now 28.9% in urban areas and 25.8% in rural areas. Dr. James Kaima is a senior consultant cardiologist and a senior lecturer at the Department of Medicine at Makerere University. He explains what hypertension means.
So for the heart to be able to pump, it needs to generate a pressure. And it's that pressure then that the doctor or the nurse or the healthcare worker measures when you go to the hospital. Now, when the blood vessels against which the heart pumps this oxygenated blood start to narrow, then the heart has to generate a higher pressure for it to perform its duty, which is to get oxygen to the rest of the body. However, the higher that blood pressure, the more problems there are, because then the lining of the blood vessels starts to get destroyed. And it's that process then that gives you the complications of high blood pressure.
Dr. Kaima says blood pressure is measured using a pressure machine which reads two numbers, the systolic and diastolic, which basically estimate the pressure at which blood moves within your veins.
It may look like a number, but the number means a lot of things. It means this number can mean that you actually get a stroke. And these problems happen if this blood pressure is consistently elevated.
A continuously heightened pressure is a risk factor for diseases that sometimes turn fatal and is commonly asymptomatic.
You can get a stroke, you can get a heart attack, you can get blind, especially if the small blood vessels in the eyes are destroyed as well. And for some people, if their blood pressure hasn't been controlled, they can actually get problems with their reproduction. Men especially do get erectile dysfunction.
Blood pressure can also be heightened by some external factors, including damage on body organs and pregnancy in some women.
If you are in a highly stressful environment at work, especially, you can get high blood pressure. Age, as we age, there's a likelihood that we're going to get high blood pressure.
Once diagnosed early, hypertension is reversible using lifestyle changes and medication for advanced complications.
Someone can be treated and be cured of high blood pressure, because if we find that the problem is a hormonal problem, if you fix the hormonal problem, that blood pressure can be cured. If we find that the cause is a kidney problem, if that kidney problem is treated, that blood pressure can be cured. If you are overweight or obese, we know that that can increase your blood pressure. And it's been demonstrated that for some patients, if they come to the healthcare worker and they're advised to lose weight and they do lose weight, some of them can actually go for medication for high blood pressure.
However, Dr. Kaima says once you're on medication, stick to it like you depend on it. For a fact, Olul had dropped off his drugs prescription, and this is what happened.
The heart beating in a kind of abnormal way. Sharp beats. You get like some sharp pains around the heart. So when I began feeling these symptoms, I got scared. I was like, I think my pressure is back. Let me go and do some tests. So I came and did some tests last week. The doctor was like, you need to get back to your drugs.
This year, the World Health Organization urges you to measure your blood pressure accurately, control it, and live longer. Walter Mwesigye, NTV.